The brain is one of the most energy-demanding organs in the human body. Despite its size, it consumes a significant portion of the body's oxygen. To meet this demand, an intricate network of arteries delivers a continuous supply of blood. This circulation is not optional, it is essential for survival. A stroke begins the moment this flow is disrupted. An artery becomes blocked, or a vessel suddenly ruptures. In either case, brain tissue is deprived of oxygen. And within minutes, brain cells begin to lose function and slowly start to die. The most common type of stroke is ischemic stroke. It occurs when a blood clot blocks an artery supplying the brain. These clots often form in arteries narrowed by plaque buildup, a process that develops silently over time. In other cases, a clot may travel from the heart and suddenly lodge within a brain vessel. When this happens, blood flow stops instantly, and the affected brain cells are left without oxygen. Not all strokes are caused by blockages. In some cases, a weakened blood vessel ruptures, causing bleeding within the brain. This is known as a hemorrhagic stroke. As blood leaks into surrounding tissue, it disrupts oxygen delivery and increases pressure inside the skull. One of the leading causes of this condition is long-term high blood pressure, which gradually weakens artery walls. Stroke symptoms often appear suddenly. One of the simplest ways to recognize them is the FAST method. Face drooping, arm weakness, speech difficulty, time to act. These signs indicate that part of the brain may not be receiving enough blood, and immediate action can make the difference between recovery and permanent damage. When a stroke occurs, treatment must begin as quickly as possible. In ischemic stroke, doctors may use clot-dissolving medication to restore blood flow. In some cases, a procedure known as thrombectomy is performed, physically removing the clot from the artery. For hemorrhagic stroke, treatment focuses on controlling bleeding and reducing pressure within the brain. The goal is to protect as much brain tissue as possible. Many strokes can be prevented. Controlling blood pressure is one of the most powerful steps. A healthy lifestyle, regular exercise, balanced diet, and avoiding smoking helps protect blood vessels over time. Managing cholesterol and blood sugar also reduces risk. Prevention begins with awareness and the choices made every day. A stroke can change a life in seconds, but understanding how it happens gives us the power to act, to recognize the warning signs, to respond quickly, and to prevent it before it begins. Because when it comes to the brain, every second truly matters.